A lot of you know me as the experimentator because I happen to be the #1 vasectomist in Arizona. Last year alone, I performed 1,200 vasectomies. But did you know that I also help make America pee again? So in this video, I'm going to talk about a procedure that I perform a lot of. It's called TURP, also known as transurethral resection of the prostate, commonly known as Roto. Now, this is a procedure that is used for the treatment of guys with enlarged prostates and they have a lot of trouble urinating. Actually, my dad had to go through this procedure many years ago. It's extremely effective. So I'm going to go over some of the frequently asked questions and some of the misconceptions that the public has regarding this procedure. Now, keep in mind that this is in my hands. If I were the person performing this procedure, these are typically your results. I cannot vouch for somebody else performing this procedure, but these are my typical results. So for those of you who don't know me, my name is John Lin. I'm a urologist in Gilbert, Arizona, and I work at Sunrise Urology. This is a live stream going to Facebook and YouTube. As always, I welcome anyone with questions to put them in the comments, and I will try to answer them live or try to answer them on the replay if you're watching this on a replay. Okay, TURP. This procedure, and one of the biggest questions when I tell patients after I evaluate him that he needs a TURP or he should consider a TURP, one of the questions immediately asked by the patient is this covered by Medicare? Now, I know YouTube audience is worldwide, so if you're not watching this in the United States, Medicare, just to let you know that Medicare is a healthcare insurance here in the United States, established and administered by the U.S. government. So once you get to a certain age, then you qualify for Medicare, or if you have some disability, then you qualify for Medicare. But Medicare is by far the largest insurer or payer for people in the United States. TURP is a procedure that is covered by Medicare. So rest assured, when your urologist talks to you about TURP, it is covered by Medicare. All right. The other thing that you need to understand is that this procedure may make it easier for you to urinate, you, the man with an enlarged prostate. It may also incidentally eliminate some other problems related to an enlarged prostate. But sometimes some of the constellation of symptoms that you may experience, such as frequency of urination, meaning you have to go and then you have to go again. Feeling like when you have the urge to go, you have to run to the bathroom, urgency, so frequency, urgency, and also having to get up at night to pee frequently. So frequency, urgency, and nocturia, that getting up at night to urinate a lot, is called nocturia. Now, these three symptoms that you experience are called irritative voiding symptoms. These symptoms may take some time, possibly months, if not longer, to recover. Often it is behavioral. The man is used to voiding frequently, feeling like he's got to run to the bathroom right away, knowing where all the bathrooms are, and habitually gets up multiple times a night to urinate. Some of these symptoms are behavioral, meaning you would have to retrain yourself, retrain your mind, retrain your bladder, if you will. It may take several months to recover. What typically happens right away is that you'll have a very strong stream. A lot of guys tell me, I feel like I'm 18 again. I'm voiding like I'm 18 again. I can write my name on the wall, or I can pee like a fire hydrant. Those are not uncommon descriptions of guys after undergoing TURP and after recovering. But keep in mind the feeling of frequency, urgency, having to get up at night to urinate, called nocturia. Those symptoms may take some time to resolve. And it may sometimes, depending on how long you've been suffering with these urinary symptoms, it may not completely resolve. My guys are typically pretty stubborn. They ignore their urinary problems. By the time they come to see me, they've already been habituated to voiding a certain way. So sometimes their bladder's already damaged from constantly having to fight against an enlarged prostate to try to get urine out. Unfortunately, sometimes that damage becomes permanent. Some physical changes occur within the bladder, which makes it impossible to recover. So I urge all guys with urinary difficulties, especially as you get older, to seek the care of a urologist sooner than later, so that sometimes the bladder, unfortunately, ends up completely quitting. I have a few patients in the practice who waited for so long that their bladders no longer possess the ability to squeeze and empty their urine. So they end up having to suffer with bladder infections, bladder stones. Sometimes they have to wear a catheter all the time, a tube draining out of the penis, to empty their urine. Sometimes they end up having to stick a catheter, a tube, into the urethra multiple times a day just to empty their bladders. So I urge you, if you have trouble urinating, to seek care sooner than later. Your bladder will thank you for it. All right. Another common misconception of TURP is that, I don't know where, well, I guess I can understand this, but in the past, during residency, during my training, after we perform a TURP procedure, the patient stayed in the hospital multiple nights, and they have this irrigation that goes into the bladder, and then washing the blood out of the bladder. It's called continuous bladder irrigation. That happens for several days, and it's almost guaranteed. So in the past, patients would have to stay overnight in the hospital, and that was how I was trained. However, because I've done so many of them, and I'm really meticulous when it comes to making sure that the bleeding is completely stopped before the patient's out of the operating room, I can't remember the last time I had to keep a patient overnight because I need to run that continuous bladder irrigation. Almost all of my TURP patients go home the same day that they undergo the procedure. And I will say that again for those in the back of the room. My TURP patients go home the same day, typically, almost every single one of them. Do not listen to whatever you read online or maybe. So again, this is my experience. This is in my hands. Not all urologists do it this way, but when you have a procedure, a TURP procedure, you go home the same day, and typically you're not staying in the hospital. So it's an outpatient procedure. Outpatient procedure. Another question guys typically ask me, well, do you do it here in the office? And the answer is no. The procedure is done in the operating room, meaning under anesthesia, typically under general anesthesia, meaning you're completely knocked out, completely asleep. You won't remember a thing. You won't feel a thing during the procedure. And here's another thing guys are very apprehensive of. That catheter, that tube draining your bladder, that tube is inserted under anesthesia while you're asleep in the operating room. So you're not going to experience somebody putting a catheter in. When we take it out in the office, you will feel that, but the discomfort is minimal. If you don't believe me, ask my medical assistant, ask someone who has undergone the TURP procedure. Getting the catheter out is not a big deal. Because the surgery is done in the operating room and you are completely put to sleep, that means somebody will have to drive you home and kind of watch you after the surgery. And again, you go home the same day as the surgery in my hands. I can't vouch or speak for other urologists who perform this procedure, but if you have it done by me, you typically go home the same day. In the past, this is more of a technical aspect of the procedure. In the past, we have to worry about how quickly we need to do the procedure. And that's because of the irrigation fluid that we use. It's glycine or sorbitol. But nowadays, I can't remember the last time I used glycine or sorbitol when I do a TURP. It's probably during residency. And that's been about 19 years ago. Nowadays, TURP is done using saline as the irrigation fluid. Now, who cares, right? Saline is the same type of fluid that you get in your veins if you get IV fluids. So it is physiologic. That means the previous worries about using glycine or sorbitol are no longer in play. So I literally can take my time when I perform this procedure to achieve the biggest urinary opening by opening up the prostate for the man so that he could void like an 18-year-old. Now, typically, that's what happens. So every individual is different. I'm talking in generalities here. So your procedure may not be the same. Your outcome may not be exactly the same, but I'm telling you in general, for most of my patients, this is what happens. Now, you may be wondering, how long does this procedure take to perform in the operating room? Typically, 1 to 2 hours. And that is not really the time it takes for me to physically do the procedure. But keep in mind, when you go to the operating room, it's a big ordeal. It's a big orchestrated ordeal involving multiple people. You are admitted to the surgery center. Nurses check you. They start an IV on you. They make sure you understand the procedure. They have you sign paperwork. We make sure all the ducks in a row. And then we transport you to the operating room. Now, that's when I start the clock, 1 to 2 hours. We then have to transfer you to the operating table, put you to sleep under anesthesia. Once you are asleep, then we position you, and then we drape you, cover you up in sterile draping, and then the procedure is done. So that is when I come into play, when I actually do the procedure. So it takes a while to get you on the operating room table before I can start the procedure. And then once I get started, sometimes, like for instance, today I did a procedure in a half an hour. Sometimes it takes an hour and a half. It depends on the patient. So if your prostate was what's called friable, meaning it likes to ooze bleeding, I would have to be more meticulous and take more time to make sure all the bleeding is stopped during the procedure, and especially at the end of the procedure, so that you can have a safe, effective outpatient procedure. Some guys have big prostates, which require that I resect a lot more. It takes longer because there's so much more tissue that I need to remove. So those procedures take a little bit longer. All right. Another question that guys ask is, how do you actually do the procedure? Do you cut on my skin, or where do you go in? Well, the procedure is performed using a telescope inserted through the urinary tube, so I can look at the prostate, look at the bladder, and then the procedure is done through that tiny little instrument. There are no incisions, no cutting of the skin at all. Everything is done through the urethra, through the urinary tube. You may be apprehensive, but you're going to be asleep. You're not going to feel a thing. You're not going to remember a thing. So it is very comfortable for the patient when they go through the procedure. I don't like discomfort myself, and I certainly don't want to put my patients through a lot of discomfort when they go through the procedure. So again, if you have any questions, please feel free to leave them in the comments below, and I'm going to look on here. Len says he's watching this video. Thank you so much. And if you have any questions, feel free to leave them in the comments, and I'll try to answer them during the live stream, or I will answer them on the replay. Okay, let's go on. So the procedure takes about, today, half an hour, sometimes an hour and a half. It just depends on the size of the patient, the size of the prostate, and also sometimes bleeding dictates how meticulous and how much longer I have to take to perform the procedure. All right, and it is done with a telescope, no cutting of the skin. And then guys are often worried about this tube called a catheter draining their bladders. A catheter is inserted under anesthesia. Again, you're not going to be feeling any of this stuff. You're going to be asleep. And typically, guys are worried, oh my gosh, it's going to be super uncomfortable when I have to wear the catheter or drainage tube. Typically, again, it varies by patient. Typically, the catheter stays in the patient for about 3 days. Typically, for my patients, 3 days. Again, it's individual. I performed a procedure today, a TURP today, and I'm taking out the guy's catheter tomorrow because there was so little bleeding. It was so, as we surgeons call it, so dry in the field that I feel comfortable getting that catheter out right away, because I understand the catheter is uncomfortable. And so guys want it out ASAP, and that is what I try to do. When he's wearing the catheter, he's uncomfortable. He feels like he's got to go pee all the time, sometimes leakage around the catheter, and it's uncomfortable. I totally get it. And I want to minimize the time that the guy has to wear the catheter, so I try to get it out as soon as possible. And that typically is 3 days, sometimes 1 day. Okay, it's just individual. I'm going to tailor it to your prostate, to how your anatomy is built and how things go. All right. Guys also ask me, well, how long does it take for me to recover from this procedure? And the general answer is it may take several weeks or longer, depending on the patient. It is highly individual. And also, what is full recovery, right? Full recovery meaning you're going to have a strong stream and feeling like you're emptying your bladder right away. Well, that's going to be pretty darn fast, typically. But if you're talking about, remember I talked about irritated voiding symptoms, feeling like you got to go frequently. When you have the urge, you have to run to the bathroom, urgency, and getting up at night multiple times to urinate, called nocturia. Those symptoms, again, may take several months to improve or resolve because a lot of it's behavioral. So again, it's highly individual, and it depends on your mental expectations versus somebody else's. Lewis on YouTube asks, I had it, now he has leakage, and his love life is in a tank, and I'm going to talk about that in just a minute. Okay. Although very rare, this procedure may affect your sexual function, including erectile dysfunction, okay? But because of the newer technologies that I use saline, and the energy source that I use to remove or cut out the prostate tissue is bipolar electrocautery. Bipolar electrocautery. Saline, bipolar, the energy spread from the anode to the cathode is millimeters away. It is so close. So the thing that we worry about is when you're using monopolar in the old days is that the energy from the loop is transferred to a grounding pad somewhere else on a patient. So sometimes that distance is theorized that the travel of the electricity may affect nerves, including erection nerves. All right. However, the technology that I use, the way I do it is with saline, with bipolar energy levels. So the spread of energy is much shorter in distance. And theoretically, and in practicality, I have not noticed guys with erectile dysfunction after the procedure. On the contrary, interestingly, anecdotally, I have some men who have said that they had an improvement in his sexual function after TURP. You don't have to take my word for it. You can go to Sunrise Urology, where this video is being live streamed, and you can look through the videos And you'll have guys telling you that their sexual function improved after TURP, although it is not the intent, not the purpose of performing a TURP, but these guys have said that their sexual function improved. Okay? Also, as Lewis said in the YouTube comments, that he was having some sort of a leakage. In my experience, permanent urinary incontinence or urinary leakage after a TURP is extremely rare. Extremely rare. That's because I take very careful I'm very careful at looking at where the anatomy is located, where the valve that allows you to control and stop your urine stream, where that is located during that procedure. I take extreme care, as all urologists do, because that will be devastating to cause urinary incontinence after a TURP. And as a matter of fact, what took my dad so long before he had a TURP, it was because he was worried about urinary incontinence. So urologists, all of us, we are extremely aware and extremely careful to make sure that there's no urinary incontinence, or we try to do everything we can to avoid urinary incontinence, causing urinary incontinence after this procedure. Okay, let's see. Lewis also said that his worst problem was bladder spasm. It was painful for him, it was agony, and nurses would not help him with the pain. So bladder spasms are very common anytime that there's a foreign body in the bladder, including a catheter, a Foley catheter. So this tube that drains the bladder actually has a balloon inside the bladder to kind of hold it in place so it doesn't fall out. Anytime there's a balloon or any sort of foreign body like a catheter, what's your bladder's normal reaction? Your bladder wants to get rid of it. So the bladder is going like this, trying to squeeze and get that foreign body out of the bladder. And sometimes guys experience bladder spasms, which seems like what Lewis is complaining about in the YouTube comments. Those are very, very common. It doesn't matter if you have a ureteral stent from kidney stone surgery, typically, or a Foley catheter, a tube in the bladder. Some guys experience strong bladder spasms, and some guys are like, it's no big deal. Highly individual, just like recovery. How long it takes, what you experience is very individual. Just like a Foley catheter in the bladder. Some guys, couldn't care less. No big deal. But some guys are extremely, extremely sensitive to a Foley catheter. Okay, let's move on. Something that does happen, and I tell, even though studies will quote you X% of patients will experience what's called retrograde ejaculation, also known as dry orgasms after a TURP or Roto. I tell my patients that I guarantee that you'll have dry orgasms. Why do I say that? Because I will underpromise and overdeliver. Yes, some guys will still have semen come out after a TURP. So retrograde ejaculation meaning there's no semen coming out with ejaculation, with loosely called orgasm. Nothing much comes out. So typically, guys are older when they need to have a TURP, unless you have a really young wife and you're trying to get her pregnant. By the time you need a TURP, having that lack of semen output is typically not a big worry for a lot of my guys. Or I've heard anecdotally from a colleague that he operated on a porn star and he ended up not being able to work anymore. So anyway, those are the two things that I worry about. Guys not being able to get his wife pregnant, and if you're in the industry, then TURP may not be a good option. There are other options to help open up the prostate that may help preserve antegrade ejaculation. So keep that in mind when it comes to TURP. You will have less semen or sometimes no semen coming out during ejaculation. So keep that in mind. All right. TURP procedure. A lot of guys are wondering, sometimes these guys are younger, believe it or not. Sometimes I'm operating on guys with enlarged prostates who are in their 40s and 50s. Now, typically, these guys have long life expectancy after TURP. What if he needs another treatment for enlarged prostate because of regrowth of prostate tissue? Sometimes that enlargement of the prostate can occur many years later. And clinical studies have shown that at 5 years, only about 5 to 10% of men require additional treatment after undergoing a TURP. TURP, also known as Roto, is an extremely durable, meaning long-lasting procedure. For a lot of my guys, if they're older, it should last him for the rest of his life after performing this procedure once. It has been called, believe it or not, the gold standard when it comes to taking care of men with enlarged prostates. And in the United States alone, there are over 40 million men with enlarged prostates. So there are a lot of us with enlarged prostates. TURP is an extremely durable procedure. It has been called the gold standard. You will hear and see all sorts of new technology being developed to help men with enlarged prostates, because this is a big problem. A large population just in the United States have BPH, benign prostatic hyperplasia, or an enlarged prostate. There are a lot of new technologies out there, but they are all compared to TURP, because TURP has been and remains, in my opinion, remains the gold standard. Outpatient procedure, inexpensive when it comes to supplies that need to be used, and patients do extremely well, an extremely durable procedure. So for the right patient, TURP is a great procedure to undergo. All right. During your recovery, this is something that guys need to remember. During your recovery, after your TURP, you may temporarily experience worsening frequency and urgency of urination, meaning when you have the urge, you have to run to the bathroom. Typically, that is really bad for some guys. Again, highly individual. Some guys are like, no worse than before. Or some guys will tell me they recovered extremely quickly. Also, during recovery, because I did go through the urethra, the urinary tube, I did put in a catheter at the end of the procedure. So once that catheter comes out, the guy may experience a little burning with urination and blood in the urine, including sometimes passing a few clots. Now, after the catheter comes out, after TURP, what I typically do is prescribe an antibiotic and also a medicine that turns the patient's urine orange. What that medication does is it coats the urinary tract, including the urethra, so that there will be minimal to no burning with urination. Most of my TURP patients do not require a narcotic medication after the procedure. Narcotic medications, especially these older guys, can cause dizziness, can cause constipation, and they can't think straight. Breathing issues. So nowadays, and I've been doing this for a while, I have not given or prescribed narcotic pain medication after TURP for many, many years. And guys generally do great. All right. Couple more. Some guys have reported strong urgency, the urge to run to the bathroom, like I mentioned. And he may require the temporary use of absorbent products, meaning wearing a liner in the underwear, because he can't get close enough to the bathroom. And sometimes the urge hits and then he can't make it to the bathroom. So some guys have used absorbent products briefly. And again, this typically goes away shortly after TURP. That urinary urgency, that frequency typically goes away after TURP. Lastly, I want to tell you that I have done a lot of TURPs. I love doing the procedure. Again, outpatient procedure. I'm doing this procedure pretty much multiple times every single week. And I love doing it because it helps guys void right away. And these are some of the most grateful patients. They end up being my evangelists, my cheerleaders, and they become my raving fans. And they go tell all their friends to come to see us so that we can take care of their enlarged prostates. So I can help make America pee again. And if you go to www.makeamericapeeagain.com, you'll be treated with a short video that looks kind of like a political ad, but it's a fun video that I created many years ago, 2016, shortly after the primaries, and it was between Donald Trump and Hillary Clinton. After the primaries, before the general election, I thought, I gotta use the current political climate and come up with something. So makeamericapeeagain.com. Check it out. All right, let me see if there are any comments on YouTube and Facebook. Seeing no further comments on Facebook or YouTube, I am going to. You're welcome, Wiley. You're welcome, Lewis, on YouTube. Ask any questions you want, and I'll try to answer them. So, bottom line, if you know some guys with urinary difficulties, have him get checked out right away. Sometimes you wait too long, your bladder becomes shot, meaning no longer has the ability to squeeze, and you end up having to wear a catheter all the time, or you end up having to put a tube in your bladder multiple times a day to empty your bladder. So don't wait that long. Don't wait until things get so bad. Don't wait until it's too late. So get checked out sooner than later. Thank you so much. Thank you all so much for watching. And take care of yourself. Take care of each other. I thank you for the privilege of your time. Take care. Bye-bye.